Singapore's rising aging population has led to an increase in the demand for care for the elderly. But while building of facilities are being ramped up, there's also the critical issue of staffing. The Health Ministry says it has formed a Home Care Workgroup to guide development of care standards as well as manpower plans. In this week's Spotlight, Vimita Mohandas looks at what has to be done to care for Singapore's elderly.
Rain or shine, home care nurses like Haryati Sahak go on their rounds.
Good afternoon, how are you?
Madam Haryati sees 7 patients a day. One of them is Mr. Trevor Holden. The 87-year-old requires regular wound management due to a heart condition, which causes a swelling in his leg. Besides caring for patients, she also advises their caregivers on how to manage the patient's conditions. Madam Haryati switched to home care after serving as a nurse in various hospitals for 20 years. And she says this job is not for the faint-hearted.
We have to go through to patient's house, no matter how clean or dirty it is. We have to take it with a stride. Getting to us, maybe it's dirty, but to them, it's their home. Sometimes to get things through, to get changes done is very difficult. It takes a lot of time, it takes a lot of patience to drill some messages through to some of the patients. Sometimes it's even simple thing like being compliant to medication.
In 2011, there were about 5,600 persons in home-based care. A year later, there were 7,000 who needed home-based care. The Home Nursing Foundation says the average waiting time for a patient to receive home nursing can take up to 7 days. So to help ease the load on home care, daycare centres have been set up for more mobile seniors. In 2011, there were about 2,800 people in daycare centres, and the number increased to about 3,000 in the past year. In 1970, the life expectancy of a 65-year-old was 8.4 years more, which adds up to 73.4 years. In 2012, the life expectancy of a 65-year-old was 20.4 years more, which adds up to 85.4 years. This means that the average individual actually lives 12 years more than in 1970. With more people living longer, demand for services for the elderly has also increased. But even as daycare centres are running at 84% capacity island-wide, the wait for a place in some locations can stretch up to 50 days, as some elderly prefer centres near where they live. So to reduce waiting time, 240 places will be added within the next 6 months. And by 2020, MOH plans to develop about 60 new integrated daycare centres to serve an additional 5,500 seniors. Support services for the elderly like day and rehabilitation care will also have to be extended.
Currently, most of them, their children will come home, will be able to take over the care after office hours. Some may come home much later, and some may not have children. So we need to think about how we can support them during the office hours.
Mr. Gan adds having medical care such as a GP or polyclinic located near flats for the elderly is something Singapore can consider developing. While plans are in place to ramp up infrastructure, the bigger challenge is finding the staff. At the rate our aging population is rising, there is an urgent need to recruit more into this field. And that's why in April this year, the Ministry of Health set up the Home Care Working Committee, comprising professionals in the field and service providers. Now, besides looking into how services can be developed further for the elderly so that they can age comfortably and with dignity within the community, it will also look into how to recruit and train the manpower needed. Industry experts say recruiting locals remains a challenge. So one of the strategies is to spur the interest of the young to take care of the elderly. For For example, ITE College East rolled out its 2-year Community Care and Social Services course in 2010 and just this year its eldercare course. And the school has said that it has been receiving a healthy take-up rate for both courses. Now in January this year, the intake for its Community Care and Social Services course was 43, and for every one place that was offered, there were 2.24 students fighting for it.
What surprised me was that even when we first started the course in 2010, our subscription rate was very healthy and it was very, very high. In fact, more than twice. The statistics that we've been gathering, we're still gathering the statistics, tells us that about 40% of our graduates are going into elder care. That means they are going to jobs that are taking care of the elderly.
Many of them say they signed up because of their own personal experiences.
For me, it was my grandmother, because she has 4, and I was looking after her. So I was thinking that if I joined this course, I could learn some basic knowledge and skills to apply for her as well as the elderly out there.
When I was taking care of my grandfather, it developed that deep interest in helping elderly. He couldn't move freely like how he used to, and he can't even feed himself. So he actually needs assistance.
Besides looking into infrastructure and staffing needs, costs of elder care services are constantly reviewed to keep them affordable. For example, home nursing costs at the Home Nursing Foundation range from $12 to $59, while at Touch Services, the range is from $12 to $90. But for Mr. Holden, his daughter Valerie, who is his sole caregiver, doesn't have to fork out a single cent. That's because they are under the public assistance scheme. Both of them say they have benefited from home care nursing, as it has saved them the hassle of having to leave the house to seek treatment and wait at polyclinics.
They also look at the holistic care, not just treat the wound, but also ask him a lot of questions about his mental state, whether he's depressed, whether he's sleeping well, and they take note of all the vital signs that could point otherwise to a source of infection like high fever. So they do the fever check, blood pressure check, and for those who have diabetes, they do the blood sugar count as well.
Valerie, who is single, now works from home so that she can look after her father. But she wonders if she will be able to tap such home care services when she grows old. With the number of elderly citizens in Singapore aged 65 and above estimated to increase considerably from about 380,000 in 2012 to about 900,000 in 2030, the race is on for Singapore to cope with this increasing pool of elderly citizens.